So I'm Dr. Jana Valine. I am one of our family practice sports medicine doctors here at Rejuv. So I also have specialty training in what's called interventional orthopedics, regenerative medicine, medical weight loss. So it's kind of just some newer fields. So not everyone's heard of regenerative medicine or interventional orthopedics. That's what we're going to focus on today is just what are some alternative options from surgery and just alternative options to pain in general. And so, most people are here because either they've had pain, dysfunction, they know someone, they're here for themselves or someone else. And so, what we try and focus on is the traditional medical model has been, a lot of cover-up. So steroid injections, anti-inflammatories, narcotics, and surgeries. And so when those are not options for people anymore, are there other options that we can use our body to heal our body? And so my goal today is to really educate you on what happens to our bodies. So what happens with trauma, injury, aging? What happens when you get arthritis? What does that actually mean? And then how do we start to reverse this? And it's not like talking about, growing everything back, but how do we start to reverse the disease process? And obviously the sooner that we are able to do that, sometimes the better. Healing responses. So if you sprain your ankle, your body's going to heal. You get a cut, you're going to heal. We all have bodies that can heal us, and that's why we're here today. So what we want to do is sometimes our bodies forget how to do that. And so how do we help remind it how to actually start to heal ourselves again, and what goes into that? Because it's a lot more than just injections. So how do we start to reverse that process, understand what that process is and why we got here in the first place? So looking a lot at our root cause. And so our healthcare model obviously is a little bit different. We have the gym, we have physical therapy, we have our clinic. And so we really try and work on this integrated model because it's not just about what we're injecting, it's about your overall health. And so if we're going to use your body to help heal your body, we want to make sure you have good, healthy building blocks to start with. So what we're going to talk about today, just a little background in what kind of alternative, alternative doctor, alternative medicine means, because really what alternative means, it's another option. That's how I tend to think of it. And usually what it's being used for is something that's not mainstream. So, usually what happens is something's an alternative treatment, and then eventually it becomes mainstream, and so it's no longer an alternative therapy. We tend to think of it as it's another option for you guys. It's another option to sort through what are your options to actually try and get healthy and get better, and how you can be a big piece of that. I think as on one hand, we're the doctors who are helping and we're educating you, but we have a big team here for a reason, and we really want our patients to be on this journey with us and be a big piece of your healing and your journey, because what you guys want, what your outcomes are, that really matters to us. So it's not so much what the MRI shows. I don't know what hurts you, what your pain is, what do you want out of this? So that's one of the things we try and do here a little differently is focus on that. And so one of the things that people always ask is like, okay, if you had this problem or if it was your mom, what would you do? And so, actually prior to being here, I did the same thing. I told my mom to do the same thing that I told all my patients. And that's because I got trained in a very traditional model. And I think sometimes people are like, gosh, why did my doctor not know about this? Why have they not told me about this? And, I'm only a few years having been removed from that traditional model. And I still know because I went through, 12 plus years of training where that's where I was taught. And so your mentors teach you that, they got taught. And so I think sometimes we try and get focused on, why don't they know it? And I think we have to look back at, why didn't all these other people know it? And you're being taught by people who are very smart. They truly want to help patients, and this is what they were taught. And so to go against everything you've been taught and say, hey, that might be incorrect, and maybe it's right for one person but not for everyone, is a really big deal. And it's really hard for a lot of times physicians and other healthcare professionals to sometimes step away and say, I'm going to go against the grain because this is what's being done. Plus you have all the fight back from healthcare, just the facilities, the insurance companies. There's a lot more that goes into it. So I think we need to step away and not always blame, the doctors, like, why don't they know this? Because I didn't know this. I happened to fall into Rejuv. I was working in Brainerd, in the Crosby area, and I was still doing lots of steroid injections. I was destroying people's joints. I was telling them to take anti-inflammatories. I was telling them to use the, anti-inflammatory gels. I was, prescribing narcotics and sending them for surgery. And so those were all things. When my mom got ankle arthritis, I told her too. So I truly kind of knew, I believed, because that's what I was taught. Then you start to get patients back. And they start to tell you it's not working. And they start, it's not working. And you start to think through, why isn't it working? Why are these people back in my office all the time? And is it really that every person could possibly come back and tell me every single time it's not working? Or is there something wrong with my treatments? And my mom and I started doing races together. I've ran my whole life. And she started running with me, and she had a trauma. She was playing with her grandkids and sprained her ankle, and she got ankle arthritis a couple years afterwards, and she got to the point where it was really hard for her to run. And I was like, it's fine, Mom, just take some anti-inflammatories. And she did okay for a while, and then she couldn't do that anymore. Okay, just use the topical ones, and she did okay. And then I started to look through, it's like, yeah, anti-inflammatories aren't very good. You know, she was on Coumadin, she had some other medical problems. Like, you start to read through, and you're like, yep, this insert was a prescription med. No one would ever take this. You know, if you actually look at the research studies, you have an increased risk of going to hip or knee replacement, increased risk of cartilage breakdown, leads to heart attacks, strokes, the bleeding risk. So they're bigger problems than people think. And so it's like, all right, well, if I don't do that, what are my other options? And so a lot of people are used to cortisone injections. And so I told her, I was like, yep, just go get a cortisone injection then. And she did that. And she did a couple of them, and each one worked less and less, and eventually stopped working. And you think through how silly that sounds to someone, because I would tell everyone that, like, well, I'm going to do a steroid injection. It might work amazing, and we'll just keep doing it, and you can only have it every 3 months, and at some point it's going to work less and less and stop working. And you're like, why would that be? Why would be doing these injections? And again, you start to dig through the research, like, oh, yeah, both the anesthetic and the steroid cause cartilage breakdown. Again, we're taught this other side where you can review those articles a little differently. And you can go through the clinic, because people are telling you, well, clinically, this is what I see. Clinically, I'm seeing all these patients getting better. And so you're kind of trusting that clinical outcome until you actually go out and practice and realize this isn't real life. People aren't really getting better. You get these really good cases where they got one, and they come back and they're like, yep, I had one 10 years ago and I did amazing. That becomes less and less the norm. That's not what people tell you. So when you start to see these people back, they're your patients, you really start to wonder what's going on. And so the same thing, and at that point I didn't know that this existed. And we still are always like, oh, I wish we would have known. But I think now, my mom ended up having an ankle fusion. What she tells me, because I still get so frustrated, I'm like, oh, I wish you wouldn't have had to have surgery. She's like, but I know. Like, her surgeon said, you can't run anymore. You only have a certain number of steps, and if you use those steps up, like, that's it. You're done. And she's like, I don't worry anymore. I'm going to use my steps up. I don't really care because I know you can fix me. And she's like, that hope and knowing that I don't have to be in that kind of pain again, she's like, is all that I need. So she still runs with me. We still have done more races, and, she's done okay. And she was someone who happened to have surgery and do okay, but it's not what I wanted for her. But she's like, no, as long as I know that, like, you can fix me if the problem comes up again, she's like, having that hope of not being in pain again, she's like, is most of what people need, is to know there's something else out there. The one thing that we ended up avoiding, though, was the narcotics. And most of you guys, everyone's heard about the opioid epidemic. It's what's being prescribed. And again, we sometimes get frustrated at the healthcare professionals and what's happened. And I tell people this story because when I got my medical license, I actually had to sit in a room at Minnesota Medical Board, and they actually sat me down and they gave me an article and they said, you will treat pain. And basically it was like, if you don't treat pain by giving pain medications, like, you're going to get in trouble. And so this is how this opioid epidemic started, was you had this push to treat pain, and it was not meant to be harmful. It was meant we should treat people's pain. It became the fifth vital sign, and no one was doing this on purpose to cause this problem. But then it was like, oh, you're asking me my pain. I must not have to have pain. I'm here for my blood pressure. You want to know my pain level. It became this intermixture of, we became very focused on it. And then it's like, well, what do? You feel like you have to do something. That's much quicker to give someone a prescription medication than it is to sit down and spend the 20 minutes I would spend talking to them about, well, here's why you have pain. Here's what I think you need to do. And then I'd get behind, and then I would get in trouble. And so you kind of are fighting these battles where we were taught this way, and then it's like, your pharmacy companies involved, and now we're in the trickle-down effect of, well, if we're going to say no more narcotics, what are we going to do instead? And that's where we have really failed our patients, our system. We failed the healthcare, just in general, that we've failed our patients, is that we have not had good alternatives. So we really want to focus on what are some of those alternatives to those traditional treatments. And so just understanding that there's a reason we're saying going away from those, but then we do have a big toolbox of other things that we can offer. And so my journey here is, like I said, I was up in Crosby and Brainerd, and I was doing very traditional practice, and I just got frustrated. I was like, my patients didn't like me very much, and not like for me as a person. I was just like, they were frustrated, right? And I was frustrated because I was like, well, I don't have any time to talk to you about what you should do for your diet. How do you start an exercise program without getting injured? How important physical therapy is? Talk to them about bracing, why they got arthritis, what's the root cause, all those things. So I was getting very frustrated. So I started to look for something different. And my husband and I were lucky enough that we got to travel quite a bit between when we finished training. He's also a doctor. And so I think you just get this very different perspective that, like, America's really good for emergency and trauma healthcare, and then everything else, like preventative health and primary care, we're not very good. And just in general, like our society, we're really big on like, let's not sleep, let's promote that sleep, like not sleeping is very good, that being super stressed all the time is great for us, and it's kind of the sign of like honor and like, you know, great. And it's like, no, it's like killing your body by not sleeping enough, by not managing our stress, and that we don't take naps in the middle of the day, and we don't have vacations, and people don't take their time off. And so you travel and you're like, oh yeah, everyone thinks we're kind of like, we're not very smart from that perspective. We don't take care of ourselves. And the people who do step back and say, hey, you know what, I'm not going to take call anymore. Like a lot of my colleagues were like, thought I was lazy. They thought that I didn't want to work very hard. It's like, nope, I just care about myself and want to be able to work a really long time because I like what I do. And if I'm not healthy, I'm not good to my patients. And so I think we have to kind of change as a culture and as a society how we view that. And that's one of the reasons that I was like, we happened to find this job. I was like, oh, there's a gym there. I get to wear scrubs to work. Like, this is awesome. This is my deal, because that's what I want. I want to have the time with my patients to talk about that. But I don't have all the time, so you need a team approach. You need everyone here to really talk through that. The other thing is that, so we're Rejuv Medical, and we're also affiliates of Regenix. Regenix is a clinic out of Denver. It's a company, and so they have multiple affiliate clinics, and that's where we use our lab. That's whom we use the processing for PRP and stem cell. Dr. Centino and Dr. Schultz, they were the first ones in the U.S. to do stem cells back in 2005, so they've done over 50% of the research. Their group and their other doctors at their clinic and their fellows have done over 50% of the research on stem cells, so we follow their protocols. It's constantly changing. They're like, we found this out. We have a great network of physicians who are always talking, and we want to just make sure that everyone understands what these regenerative therapies are, when they should be used, and that we're all at the top of our game of like who should be doing them, when should you be doing them, and sometimes when they're not appropriate. So that's just as important. And so through the Regenix, there's also something called the Interventional Orthopedic Foundation. So it's a group where we go through training on all of these procedures. And so we have our certifications through them. And so, you know, we're very advanced when it comes to these techniques and the procedures that we're doing. We also have gone to multiple other conferences. That's who we're affiliates of. So a little overwhelming. So let's step back and talk about what happens when you get a broken down joint. Like what happens when you get trauma, when you get injury, when you get pain, is that a lot of times what happens if you get pain, there's certain chemicals that are released that starts to cause breakdown in your body. And I think, you know, I hear that over and over, and you guys can probably all kind of say too, is everyone says, well, I did fine until I turned this age. And then it seemed like I got my knee hurt, and then everything fell apart. So we hear that over and over of, well, I was fine till, you know, my ankle hurt, and now everything fell apart. And I think what happens is that when you start to get pain is you don't move as much, you don't move as well, you tend to not eat as well, you tend to not sleep as well, and we don't manage the stress of what happens. So we have to understand that complexity of a problem. It's not just, and when I say this, like people come in, they're like, well, you're going to regrow my cartilage. I'm like, well, that's not the problem here, right? Like, yes, the cartilage is wearing away, but we have a much bigger problem, which is why did your cartilage wear away? What happened because your cartilage wore away? What are you now? Who is the person you are, and where do you want to be? And what's happened to your body? Because not just that body part broke down, your body starts to break down. And how do we start to reverse that? Not to mention people feel helpless. They feel hopeless, and they're like, am I ever going to come back from that? And that's really where we need that team approach here, which is like, yes, we can get you back. It was a very big downward cycle down, but we can start to uncycle that back upwards. So what is arthritis? That's probably the number one reason. So part of arthritis we're going to talk about today, but also tendinopathies, you know, partial tears, full tears, ligament sprains, strains, dysfunction, pain, all those things go into this realm. Arthritis happens to be one of the most common. And so what arthritis is there's actually probably some different causes. Most people think of the wear and tear or the inflammatory like rheumatoid arthritis. But they're also looking at there's probably some genetics, there's traumatic, there's metabolic, meaning there's certain things in your body if you're overweight, obese, taking prescription medications, certain chronic medical diseases that can actually make your arthritis worse. So we have to understand that most people have some component of all of those, and we need to address those issues. The other thing that happens is that cartilage starts to wear down. So you have cartilage that lines all the end of your bones. In the knee, you also have meniscus. Other joints, you have other thicker cartilage rings as well that support those ligaments, that support the cartilage. Is as that wears away, your joint tries to kind of clean it up in a sense. It tries to make a healthier environment, and in doing so, it actually causes a very unhealthy environment. It actually causes bad kind of growth factors in there. It causes yucky stuff in there. So an arthritic joint is not a very healthy joint, and that leads to more breakdown. The other thing that happens is if, like, let's say the inside part of your knee starts to collapse. Well, that ligament that supports the inside part of your knee is no longer nice and tight. It gets stretched out. The other side gets stretched more. So these nice tight rubber bands of ligaments that were supposed to do the job of stabilizing your joint start to get this micro instability. They start to wear out. Well, the more they wear out, the more things move. The more things move, the more things break down. So we have that cycle downwards. So we have the joint itself, we have the ligaments, and then we have the muscles and tendons over it that also support you. And that's why we push therapy. People are like, what is it going to do for me? Some of the best research is actually on getting very strong to support joints. It actually helps. The stronger you are, the less stress there is on your joint. So we emphasize that a lot. Obviously, weight makes a big difference, and we talk about that because obviously the stress on your joints. But it's not just, oh, you know, I have 30 seconds with you, go eat healthy and lose some weight. Like, we really, like, what do you need? What's the program you need? How do we help address that in this big picture? And this, we look at the joint itself, the ligaments, the cartilage, and then the tendons themselves. Plus, nerves play a big role, and people forget about nerves because they don't really know what to do with it. You know, nerve pain is one of the hardest pains to treat, and people don't really know what to do about it. But we have some good treatments, and a lot of times you find if you treat some of the underlying root sources, a lot of times that pain gets better, and you can start to treat some of that. And I bring this up just from a standpoint of not to be complex or confusing, but it is more complicated than people think of. I have arthritis. It's like, well, you do, yes, that's true. But why did you get it? What's the root cause? What's the dysfunction that's happened because of it? And we have to fix all of those layers to get really good outcomes. And so one of the things we want to look at is the basis for support of a joint. So this is where our bracing, our physical therapy, and then something called functional movement. So how were you moving? So you might be moving and not noticing that your foot's always falling in, or your knee's turning a certain way, or you're leaning forward. Those abnormal movements over time will cause more breakdowns. So that's where we work with physical therapy, moving out to the gym, and really working on that functional movement, not only for the pain you have, but to figure out why did it happen and to help prevent it from coming back. Having those strong muscles to support, improving your motion and your mobility. And so that's part of that abnormal gait and function we need to fix and we need to reverse, and that's how we start to get good outcomes. The second thing you need is you really need good building blocks. So if I'm going to use your body to help heal your body, you need to be in good shape. You need good building blocks. So that's where our functional medicine comes in. Really looking at the root cause, so looking at the root cause of a problem. So people kind of tend to think of it as hormones, and it's much more than hormones. It's looking at hormone optimization, looking at labs a little differently. That are they normal for you? Meaning, are they optimized within the normal range? So taking a little bit different, bigger picture look. Functional medicine, integrative medicine. That's where that realm is, because we need you to be healthy if we're going to use your body to be healthy. And sometimes people are in a lot of pain and they can't make those changes, so we treat their pain first, and we come back and we just go back and forth. But a lot of times we're doing things at the same time, and so we do a lot of work with nutrition. You know, what supplements? We don't want supplements to become what prescription meds are, which is you come into me and you say, I take this list of 15 supplements, and I say, well, why? And you have no idea why. You know, we need to know what supplements you're on, why you're taking them, and we prescribe our supplements for very specific reasons. We have certain ones that we do for regenerative procedures and pain, but we're doing it on an individual case-by-case basis of what do you actually need and why do you need them, and when do you no longer need them. You need them forever. And so then once we have that solid foundation, once we kind of have this basis of, okay, we have this good base of support, how do we start to heal that? And so one of the things I like to talk about is just the right product in the right place by the right person at the right time. And so the right time, we kind of just talk about, are you healthy enough? Are you in too much pain to make those changes? Do we need to start treating you right away? Are there some other things we can do? The right product comes in that there's actually more than just stem cells. So most people have only heard of stem cells, kind of the buzzword. It's getting all the press. So the good thing is it's actually made people aware that there's alternative treatments out there. The problem is some places that's all they're offering because they don't know there's other things out there and they're not sure what's right for that person. So in the realm of regenerative procedures, there's actually three main ones when we're talking about from a joint perspective, from a musculoskeletal or like non-surgical orthopedic realm. So prolotherapy, PRP, which is platelet plasma, and stem cell. And so what we're doing with these treatments is you're actually starting an inflammatory cascade. So the initial stage of healing is inflammation. Short-term acute inflammation is good for your body. You actually need it to start healing. Long-term chronic inflammation, not so good. So that's why a lot of times we do the opposite of what you hear, which is no ice, no anti-inflammatories, no prednisone, no steroids. You don't want to inhibit your body's healing response. We do a lot more with supplements, with heat, with good mobility, and not so much the rice as far as like resting. Like what can you do mobility-wise? What can you do to keep moving? And then how do we use heat versus trying to snuff out that acute phase healing? We want to keep that going. So what we're doing is we're taking something and we're restarting your healing process to tell your body this area is damaged, this area has something wrong with it, we need to heal this area. So the differences between these is, so I used to have Paw Patrol up here, but my son's a little bit older now, so I had to switch it to superheroes, he told me. So, and so prolotherapy, think of like if you just had one of these guys to fight for you. So, you know, they can do it, but it might take them a little bit longer. So prolotherapy is actually dextrose. It's a sugar solution. And I kind of tell everyone every day, like, ingesting a lot of sugar is not good for you, but when you inject it locally around nerves, tissues, tendons, ligaments, it has a different property on a specific receptor that helps the healing process. And so that's what prolotherapy is. You take a specific concentration of dextrose and a technique that you pepper around and kind of target the whole structure. So all those structures we talked about. It works extremely well, has lots of evidence behind it. It's been around for over 80 years. No one's heard of it. I had not heard of it. I knew about stem cell and PRP before I started here. I had no idea what prolotherapy was, but it works extremely well, and for a lot of people, it's a very good treatment. Our younger, healthier people who don't want downtime, they're too sick to undergo PRP or stem cell. So it works very well. It just takes more injections to get the same result, but you also don't have as much downtime. So it's less painful and there's less downtime. And then PRP is like if you had 2 or 3 of these guys. So it's a little bit stronger, a little bit more potent. You're going to get more of an inflammatory response, but not quite where stem cell is. So PRP is platelet-rich plasma. We draw your blood, spit it down, take the platelets at a specific concentration. And what we do is we tell our lab, like, hey, I'm treating a knee, so this is what I want. Like, I tell them based on you, your age, your problem. It's kind of like making like a little recipe. I tell them what I want, and that's the advantage of having our lab, is I can say what I want, so I can target specific areas with different products. So that's how PRP works. Injection techniques essentially the same. We're still doing that whole, kind of the whole approach of treating both the ligaments, the tendons, and the joint itself. And then stem cells, like you have the whole team. So you're going to have a leader. So part of stem cell is it's more of a recruiter. Is those stem cells go in and they tell the body this is injured. They start to recruit other stem cells. They recruit platelets and growth factors. Same thing with PRP is they're recruiters. They're telling your body this area is damaged and it's recruiting all those growth factors. They're just on different levels. So stem cell, you get a much more potent response just because of the benefits of the stem cells. We do bone marrow stem cells here. And so the bone marrow stem cells are taken from the back of your iliac crest, again, processed in our lab in a very specific way, and we do a technique to maximize the number of stem cells. So that's how, so everything I'm talking about when I'm talking about stem cells is from the bone marrow standpoint. And so, you know, one of the things we have to make sure first is, you know, let's say you had a building on fire. If you don't put that fire out, you can't start to rebuild it. And so that's the importance of your overall health, is you need to put the fire out first. You need to do a cleanup job, and then you need to come in and start to rebuild. You need that good foundation, that good base. So we need to make sure there's no inflammation. We kind of snuff that out. We put the fire out, clean everything up, and then come in. And that's really how these work, is they're kind of helping put the fire out, give us a solid foundation with our physical therapy, our functional movement, our bracing, and then our eating healthy is going to help us give those building blocks to start to put that building back together. And so then, you know, so we talked about the timing, the product, and then the right place. And so there are places that they're just kind of, maybe they use ultrasound or a machine, a lot of times just kind of poking around, they're sticking a needle in a joint and they're calling it good. And so we use ultrasound for everything. So we do a very targeted approach, again, because different body parts like different types of products. So we want to make sure we're getting it into the right area. And so we're over here on the 5% where we're doing these very precise guided injections. And it takes a lot of training, you know. So I think to go to a weekend course and say you're doing stem cell, it's not the same as what we've done. We do lots of education. Dr. Baumgartner's been doing this for a long time. He's trained me. We train other doctors to do this. So it's a very different level of what we're doing and what we're able to do. Just making sure if you're going out and looking for clinics that you understand, you know, who is this person who's going to be injecting me. And then what to look for in a clinic. And so this is where, you know, you want someone who's doing research, and we might not be doing research ourselves, but we have a registry as part of Regenix. So everything they're doing, we're doing. So in that sense, we are. And maybe we're not writing the research papers, but the research that's posted on our website is how we're doing it. So there's a lot of clinics that will post research, but it's not what they're doing. They're using a different product. They're not using the right technique, and that's not apples to apples. They're kind of, you know, doing a bait and switch in a sense, where they're saying, well, this is the research, and so it's going to work, but they're doing this. So you have to start to understand those nuances, and the good and bad is that we have a lot more freedom in this realm, but also it's kind of a wild west where people are doing stuff, and you got to explain to them what's the difference of what I'm doing versus what someone else down the street's doing is very, very different in our level of education of what we're doing. And so we do have a registry through Regenix, and we're using the data. They'll tell us, like, hey, we're seeing this is coming out, let's start to change this. I think that, so then let's talk quickly about the different kinds of stem cells. I'm not going to spend a lot of time because it gets to be kind of a little political and kind of, the legal perspectives, but I think it's important for you to understand that we're talking about bone marrow for orthopedic cases, and so that's what we do here. We do bone marrow stem cell for orthopedic cases, knees, shoulders, your joints, your extremities, even sometimes the spine. That's what we're doing. We're not doing it for a whole host of other systemic diseases. That's kind of a different realm, so we're here for that, and that's where most of the research is. So over 50% of the research is on the bone marrow for orthopedics. It's very safe, it's very effective, and so that's what we're doing. Embryonic and amniotic into a whole different category because they're being promoted as having stem cells, but they actually don't. There's been 3 different big places now that have independently tested these products, and they have no stem cells in there. Now, that's not to say they might not have benefit or work. They don't have stem cells, so either they're marketing to you that it's a stem cell product and that's false advertising, or if they truly did have stem cells, it's a whole different problem with the FDA and how it's a drug versus a tissue. So just understand that realm is they're not stem cell therapies. There's no stem cells in there. So you just have to be careful with that. Fat is a little bit more complicated because there's ways to get stem cells out of fat. But if you do it that way to get the most out of it, it's probably not within the FDA regulations. You can do fat grafting. If you do fat grafting, again, it's not technically stem cells. So we try, and it's not that these might not have benefits and people are using them and they're getting some benefits. You just have to understand what you're getting and what someone's telling you you're getting. And so I think you just need to, if you're going to go into these other routes, you just really need to dig into if this person's telling you getting a stem cell treatment, is it truly stem cell because that's what you're paying for and that's what they're telling you, so is it really false advertising, or are they manipulating something in a way that they shouldn't be manipulating to get those stem cells out, and then they're actually not legal within the FDA regulations. And so this is the safety profile for bone marrow. It's extremely safe. It's actually safer to do a bone marrow aspiration where we go back here and take your stem cells than it is for a mini liposuction. So a lot of people are like, why can't I just do a liposuction, get a 2-for-1 deal? You're not going to look great because it's a mini liposuction. I'm not a plastic surgeon. I've done a couple of them like in training, and so it's not like you come out of there all svelte like it's a little mini liposuction. And so it's actually a lot more aggressive. People have more complications from the mini liposuction than they do from the bone marrow, so it's very safe. And then where we do the injections, we can do, and this is just kind of all of our, not just Prolo, PRP, stem cell, we have some different nerve injections. So we can really find a treatment for almost everything. And that's not just injections. We're talking big picture here too. That's why we have that list of functional movement, bracing, our nutrition plans, our functional medicine is because, there's almost always something we can do for most people. Part of it's how much can we do and how much do you need to do and how much of our team approach and when do we do it. But we treat all of these areas with the regenerative therapies very, very successfully. And then will it work? And so the next few slides are actually just to show you some of the research articles that are out there. There's a lot more out there. There's ample evidence to support all of these research, the Prolo, the PRP, the stem cell. People just don't always know and kind of sometimes don't want to look at them, but there is. So these are just some websites. We have them also linked on our Rejuv. If you go to our Rejuv medical page, we have a research tab that we have these all listed. And so these are level 1A evidence, which is the highest level. So we have a whole list of these. Knee arthritis, there's quite a few more for knee arthritis. PRP, tendon injuries, ligament injuries, muscle cartilage arthritis, there's evidence out there. Achilles tendon issues, plantar fascia, rotator cuff, elbow. So the list is pretty extensive. So when someone tells you there's no proof that this stuff works, you can say, no. You can go. We have these all listed. You can go to Regenx's website. They have these all listed. So stem cell 2, and more with stem cell, because it is newer in the grand scheme of these treatments, is there's more and more coming out. And because we're trying to prove that doing these a certain way with a certain product, we're trying to get much more focused research out there too, because to just globally say they work is very different than saying, no, this works for knee arthritis using this particular product. Because if you look at something like PRP, there's so many ways to make it. They can have red blood cells, white blood cells, what's the concentration. So really looking at that much more in depth, and that's where the problem has come, is everyone's doing it differently. Same thing with stem cell, is we really need to be talking about what's actually being used for these specific studies and how are you doing, and then what am I doing so I can actually quote these. So a lot more evidence, and again, these are all on there. So lots of pages, so there's no evidence for these. And so, does it work? And I think you have to we try and be realistic about what your outcomes are going to be. I don't want to do this on people who I don't think are going to get good outcomes because we want other people to have these treatments. Doesn't mean you can't do it. It just means we say, here's what you need to do to prep yourself to get a better outcome. Here's some things I think you could do first. And so if your foundation's crumbling and all the supporting walls are falling apart, you can't put a new building on top of it. It's just going to crumble again. So it's super important we're doing all these other building blocks, and we're trying to put out the fires, and we're trying to get that good foundation and get those things in to actually get those good outcomes. So that way and that's what we found is we have some of the best outcomes in the nation because we do these things, is where it's not just about the product, about everything else that goes into it. And so, stem cells are not magic. PRP and Prolo is not magic. And so you have to, really look at, are you the right person? Are you the right fit? Do you have the right problem? And what are we going to use? And a lot of people get benefit, but also that expectation of what are we looking for? What does that benefit mean? So lots of people are getting benefit. They're getting pain relief. They're getting better function. The better function they have, the more they feel like they want to move. Okay, now they're in PT and they're moving better. Like, I want to get to the gym because I feel so great. Now they're wanting to eat healthier. They're wanting to make those changes. Oh, they kind of have their eyes open up to, I can start to take care of myself. I can start to live healthier. I can be a better person. And so it helps emphasize, and all those things you're doing are going to help your outcomes as well. So we'd like to have that cycle upwards versus that downward spiral of problems. And then a quick word about insurance coverage. There's a lot of things we do at Rejuv that are covered by insurance. So if you're going to come in to say, am I a candidate? You go to the front desk. There's people that are scheduling appointments today. You go to the front desk and you make an appointment with one of the physicians, with Dr. Baumgartner or myself. We also have a Savage location if anyone happened to travel. Dr. Robertson's there. But and you meet with us, and it goes through your regular insurance. It's a regular doctor's visit where you meet with us. The nice thing is you actually have more time with us. Our visits are much longer than most other clinics because we have to talk to you about all these things, and we do a very extensive exam, meaning you might come in for your knee, and I might start talking about your back because your back's going to play a role in your knee. And all these things I'm talking to you about, it's super important in you understanding and what our different treatment options are. So you get a much longer visit, but it goes through your insurance just like anything else. We have a handful of treatments that do go through insurance, and we give you what those options are. Things like prolotherapy, PRP, stem cell, those things are not currently covered by insurance. And people kind of start to be like, well, it must be no evidence, it must not be right. And I think we kind of have this love-hate relationship with our insurance companies, is we want them to cover everything, but we're always mad at them because of what they cover and don't cover. So don't assume because your insurance cover either covers something or doesn't cover something that matters what you need. You have people who are in politics and no medical background making those policies. So just because something's covered by insurance company does not mean it's the right thing for you. It's the most effective, has the most research, or even the safest, because you can go get lots of steroid injections, narcotics, and they'll pay for your surgery, but that might not be what you need. And so just because something's not covered by insurance does not mean that it's experimental, does not mean that it does not work. It's just the world we currently live in, trying to sort through all these details with some of these newer treatments that have been out there. And again, when we say, people kind of talk about the 12 West, what that means is there are clinics who probably shouldn't be doing them who are, and there are people who are doing them who should be doing them. And we really have to start to figure out who should be doing these and what level. And I think that's where patients start to become their own advocates. They start to do their own research. They start to look this up to say, who do I want doing these procedures? The more people we have going to high-level people doing these procedures, the more good results we're going to get, the more we can say these are working, so the more benefit we can have. And it's not that some of the people who are doing these, like you can go to sometimes a local chiropractor's office in some states, and they have a nurse practitioner or PA doing it, and it's like, they're kind of coming, walking in and injecting a joint. They're not doing the full exam. And the problem with that is it's kind of messing it up for the rest of us. I can't open my own chiropractic clinic. I can't start doing manipulations on someone. I can't walk to the surgery center and say, I decided I'm going to do surgery today. I went through very specific training to do this, and it's not that chiropractic or massage or acupuncture or surgery is not needed. I fully believe in those when they're needed, and I think we just kind of all need to learn that we are a healthcare team and that it's not me against you and that we're always fighting against each other on what should be done, that we need to come together and say we're an integrated healthcare team and healthcare model, and most people need multiple of those, but let's stay in our lanes at what we're good at, and that, I can't just go do surgery, so other people shouldn't be able to just come do what I do. That, it's a lot of training, and we need to respect what those people are doing and how they've trained. And there's lots of evidence now, these are just a few, on some of the most common elective orthopedic surgeries that don't have good outcome. Meniscus has gotten a huge, press now. It's just because they've had so many come out saying that having your meniscus removed has not been helpful. And again, there are times that surgery is indicated. Absolutely. We just need to sort through when is that time indicated and that you're not making that decision because it's what your insurance covered, not what you actually need, or because we did the wrong treatments, we did too many steroid injections, we did too many narcotics, we did too many other things that cause breakdown, and that we still never went back to the root cause. Why did this happen in the first place? If you're going to have surgery, no one's talking to you about your nutrition and your movement unless you're too heavy to have surgery. Then they might say something. So when we look at surgeries, if they're needed, we still need to look at what's the context of having that surgery and how do we still optimize your outcomes, and then how do we avoid them if we can, and then use these for the times they were really indicated. They were not meant to be for everyone all the time. They were meant to be for the complicated cases and up the level when those ortho guys are doing their surgeries and their skills versus things that I can do through with an ultrasound with a needle is much safer for a lot of people and a lot less risky. So I think what we need to focus on is kind of, when there are alternative options is they are less invasive. They have a much quicker recovery, so a few days versus a few weeks. You're up moving around, you're not immobilized for the most part. And we get preservation of biomechanics, meaning that we're not cutting pieces out or we're not sticking pieces in. We're trying to preserve what you have, and that's where all of this comes in. And so, again, our traditional treatments, they might not be the best in most cases, but we need to have something. If we're going to take something away, we need to be able to give something else to help treat people's pain and their function, and that we really need to have a model like this where we're looking at all these factors and not just kind of, zeroing in on, show me with one finger where you hurt the worst. Like that's what I always was taught in sports medicine, show me with one finger where you hurt the worst, and that's where I focus. And I'm like, no, show me with your hands, tell me. And people come in and tell me like, well, my MRI shows this. I'm like, I can read that. I can look at it myself. I don't want to know that. I want to know what's your pain, where do you feel it, how does it bother you, and what do you want to get back to. And I think for a lot of people trying to, get back to that, like, yeah, it is about me and what I'm feeling and not about my MRI, this would be a nice way to get back to that. And so this is my mom and I last fall. So we did another race, and so again, sometimes surgeries happen, and it's totally fine because knowing that there's other things we can do for most people is hope. That's what they want. Is like, I don't want to be in that kind of pain again. And when we get people out of pain, they're so thankful because they're like, now I know there's something else that I can do. So this is all. So we'll have time for questions. And so, I think one thing that we really want to focus on, you guys, that I've said is this whole kind of just model of looking big picture, how important it really is, and that you guys are a huge piece of what I choose when I choose to do things, and that what you want, what your goals are. And so we really want to hear that from our patients, and that this is a journey. This is not you're coming to see me once, I'm doing one injection out the door, and you'll never see me again. And so if that's what you're looking for, that's not what we're about, because it doesn't work. If it was, we wouldn't have all the problems that we have. So we're on this journey with you. We have lots of tools. We have lots of things to try. And, sometimes we're lucky, and a lot of times the first things we try work amazing, and sometimes they work partially and we try something else. So we just kind of pick and choose, and we have a plethora of options. So I think, people are always right, do you have something for me? And almost all the time, I usually have something to try and help people. And sometimes it's what you guys can do and how we can give you the resources to have you help us do a better job. So we have a few minutes for questions and answers, but just from a clarification is if you guys are interested in doing appointments, the easiest thing is to just go up to the front desk afterwards and you make an appointment just like you would at any other clinic. It gets run through your insurance just like you would. We do a full evaluation. We have you bring any previous imaging, x-rays, MRIs, previous medical records that you have related to the problem, and even things you may think aren't related, because a lot of times we might want them and think they are. So if you bring those with, we go through all those, we do a full exam, and we talk you through a plan and what that plan is going to be. So that's usually the easiest way. We do have some regenerative specialists and integration specialists who help coordinate, especially if you're traveling or you're just wondering, gosh, I don't know if this is right for me, that we can get you in, that they have their number, they can get you in contact. But if you guys are local, the easiest thing, because talking to you and examining you is the best way to know what your treatment options are. All right. Any questions? Yes.
I don't see much about hips up there.
Yeah, we do. Yep. Nope. Hips. Yep. What do you mean you didn't? There's some in there. Yeah. Yep. It's probably hidden in there. And that's where, yeah. I mean, it's bad, but I mean, that's why. Is it just there's that to just say can you do it or not do it? You have to look at the big picture of, do you have loss of motion? How long's it been going on? What's going on with your back? So severe hips tend to not do as well as like severe knees, but depending on what you do, when we have some things we do prior to just have some decent outcomes. And then we tell people, you know, if I look at your x-rays and examine you and we try a couple things and I'm not seeing what I want, I'll tell you. Yeah.
Yeah, I'm the bionic woman. I
Yeah.
had my knee replaced,
Yeah.
and I tore the meniscus 3 times, and each time, of course, they removed part of the meniscus, and then I was bone on bone. Could something else have been done? Then I'd have my hip replaced,
Yeah.
and that surgery actually wasn't too bad. I had back surgery
Yeah.
January 29th, and I had fusion and decompression, and
Yeah.
I'm in a lot of pain.
And that's what, yeah, that's what I'm just, is, yep, I mean, you know, I can't give you a medical opinion without talking to you. So, yeah, so that's what I'm saying is for almost every medical, like orthopedic issue, there's usually something that we can talk to you about. If there's not, I'll tell you. But if it's not something I can do injection-wise, there's usually something else we can talk about, supplement, diet, nutrition, mobility-wise. But usually there's something we do. Backs, it's our second most common, so we do a lot of those issues. Without knowing what the problem was prior to your knee replacement, I can't, you know, I can't say, but yes, most likely if it was meniscus issues, yes, there's most likely other things that could have been done, but yeah.
Too late now.
Yeah.
I guess I'd be interested in nutrition too, as
Yeah.
far as anti-inflammatory.
Yep,
What
yep.
foods are good and what foods
Yep,
are
and
bad.
we have programs for that, yep.
Okay.
Yeah, I mean, and again, I can't give you, if you want really good info, I'm someone where when people try and ask like these really quick side questions, like I'm leaving the room like, oh, by the way, my shoulder, I don't do it to be like to dismiss it. I do it because I can't give you a really good honest answer in 30 seconds. Like if you want to ask me about an anti-inflammatory diet, we'll be here all night till tomorrow morning. And I think that, you need to understand, you know, so when people want a list of foods, if it was that easy to give a list of foods, you can go on the internet and do that. It's so much more complicated than that, right? Because it might not work for you, might not like that food. What about your stress? What about your sleep? You know, so we have to take all these factors in and make sure people are getting the really good program that they need for their body and for them.
Okay. Thank you.
Yeah,
Yes,
yeah.
I think I will
Yeah,
schedule an
absolutely. Yep. And we have a wellness director or a wellness coach, wellness director too, and so she'll just she does consults. We actually have 2 people now. I shouldn't say we have 2 wellness coaches now who are doing consults with people too to just talk them through. Here's what our programs are for nutrition too. So that'd be really good for you, and they can schedule those at the front desk too.
Okay.
Yeah, yeah, absolutely. Any other questions? Nothing. Oh yeah.
What are your thoughts on CBD oil? For like
We have some over there. People love it. Yeah, try it. Fine. Yep.
What was that?
CBD oil. What are your thoughts? I said we have some here. Try it.
That doesn't work for me.
Yeah, try it and see if it works. Yeah. Yep.
You mentioned sleep. Do you have anything like a mini sleep clinic or anything, or just general health?
Yeah, so part of what we do is try and, most people, if they have another doctor to order like the sleep test, but that's where our functional medicine comes in. We have 2 nurse practitioners, and that's their specialty is functional medicine. That's usually where the sleep comes in. But a lot of the sleep comes in like, I see that people because they're in pain. So their pain's that's waking them up. So if I get them out of pain, a lot of times they start to sleep better. And then usually once they're starting to sleep better, we can start to work on some of those nutritional changes. One of the things I've seen with sleep is like, it's probably the most crucial thing to making healthy lifestyle changes is the lack of sleep. And so I think it's super, super important, and we don't give it what it needs. We send people for sleep study, here's your CPAP, and that's it. But really, sleep is so important in protecting that sleep, and that's where I think it gets much bigger into like our society and our culture that like, yeah, you need to sleep, and if you're not sleeping well, so we kind of take that piecemeal of why are you awake? Is it hormone issues? Is it because you're eating high sugar foods right before you go to bed? Is it because you have a poor diet, you have sleep apnea, restless legs, or pain? Or is it a combination of all the above? So, yep, so usually we just kind of start, why are you having sleep troubles? And we try and piece through all those things that make a difference. Anything else? All right, you guys are free to go. Thank you for spending your time here tonight. If you have other questions, you can, just like I said, you can always make an appointment. If you are interested in any of from a nutritional standpoint, medical weight loss at rejuvmedical.com. They have the email too, but if you just email medicalweightloss at rejuvmedical.com, that goes to our 2 wellness coaches, and they will be in contact with you if you want to look through those programs. Functional medicine, if you're looking at sleep, stress management, hormones, you can just schedule at the front desk with that too specifically. And again, that's an insurance-based thing that goes to your insurance. The wellness programs are not, but they have lots of different options for people. Physical therapy, a lot of times check with your insurance because we are sometimes booked out a little ways depending on the time of year. A lot of people can self-refer to physical therapy themselves. So they can actually start with you, start to work with you. And then we obviously have the gym where we have our classes and our trainers. So if you're someone who's like, I'm in too much pain, I can't move, we got vibe plates, we got infrared saunas, where there's always something we can do to find something to not hurt you and prevent injuries and keep you moving. All right? Yeah.
Massage.
We don't massage here, no.
Question.
Mm-hmm.
and has the bad side effects stay.
Yep.
Is there something that she is able to?
Not from the stem cell, like, that's kind of in that, like, it's not orthopedic stem cell, we stay away, but from a standpoint of functional medicine, nutrition, sometimes some different nerve injections depending on the symptoms, there's sometimes something we can do from that perspective, but not like we're not doing IV stem cell for that kind of stuff that's sometimes being promoted. That's kind of a little iffy for some things. Yep. Yeah.
I saw a lot on knees and hips and all of that. How about hands?
Yeah. Yep. Lots on hands. Yep. Thumbs still kind of get ignored, but thumbs and fingers we do a lot. Yep.
How about feet?
Yep. Yep. Do a little bit of everything. Yeah.
Anything surrounding fibromyalgia?
And usually we have you start with functional medicine just because of the systemic global, and they start to peel through that. So if you start to inject people with fibromyalgia, it's a little different animal. So we usually have you start with functional med, just that movement, that mobility, the wellness program for the nutrition piece. So usually if you start there, and then they start to work with you, and then they shift you over when we kind of narrow down some of the areas of pain. So we usually just work together. Yeah.
Do you have knee replacement surgery?
Mm-hmm.
Do you do the physical therapy here, or can you do that?
Yeah.
Is that covered by
Yep.
insurance?
Yep. It is. Yep. Yep. So they take they don't just take our patients. Anyone can come to our physical therapy department. Yep. All right.
It is covered, it was covered for me.
Yeah, it goes through your, so it depends on your insurance coverage. So I should always clarify with insurances, when I say our visits and like functional med, they go through they get submitted to your insurance. So the coverage of your insurance always depends on your deductible, your plan, like you guys know that deal. So when we say covered, we mean it has to get submitted through your insurance, and what they cover is what they cover. The non-covered things are things we don't even bother submitting because we know they're not going to cover it.
You said stem cell is not covered.
It's not
by
covered.
insurance. What's the range of cost?
It really depends on the body part. So, and how many body parts we're doing and how many treatments. So it really depends. So a knee for stem cells is about $6,000, and so it depends on if we're doing other areas, but that's about the average. PRP is kind of more in the $1,200 to $1,500, $1,200 to $1,800, where Prolo is more in the $500 to $600 range. But then you start to add those up because you're doing more treatments, but that's about the average.
Any guarantee on it if you have stem cell and still need surgery later then?
No, I mean, these are medical, I think no, because if you don't get your money back if you have surgery and it doesn't work, right? So, these are high level medical procedures that we're very trained. That's why we try and give you the best idea possible with the best, okay, this is what I think your outcome will be, but it's still medicine and we're still practicing medicine, and nothing's a guarantee, nothing's an absolute. And if I do my job perfect, but you go out and you walk across the street to Quick Trip at McDonald's or pack up, start smoking, how do we know why it didn't work? And usually if it didn't work, we go back. We don't just say, oh, sorry, didn't work on you. We look back, why didn't it work? What's going on systemically? Was it not the right area? Do you need more treatment? So we're usually pretty upfront, but yeah.
Just curious.
Yeah. Good question, but no. If insurance companies are paying you back for things that didn't work, I guess it would be a different story, but they don't. No one else does. Other questions? Yeah.
What is the average cost of just coming in and making an appointment or coming in?
That's what I'm saying is that gets submitted through your insurance. So it'll just be a regular. They can give you. We have estimates of what those visits are. I actually don't know the answer. I know the other ones. Yep. And if you have insurance, it has to get submitted through your insurance. And if you don't, then they have the cost of what the average visits are. I want to say a couple $100, but could be wrong. It would just be like an average visit. Yeah.
How the injections that you get, like the steroid injections, how does that break down your cartilage?
So both the anesthetic that's used, the high volume of anesthetic, and the high dose steroid actually are chondrotoxic, meaning that they're actually toxic to the cartilage in your joint. So they start to destroy the cartilage. Yeah. So you kind of get a double whammy. Yeah.
Like, I have bad knees, I've never had an MRI
Yep.
done, so if I come here, would you guys?
We have X-ray here. We usually start with X-ray, and then if we think we need more imaging, we will use the ultrasound machine just for diagnostics for some things. And if we need an MRI, we order it. Sometimes people don't need MRIs. We just always start with X-ray if that's what we think you need, and then we'll just get more imaging as we need to, and then we do a follow-up and go through the MRI and talk about your options. All right. Thanks, you guys, very much. Have a good night. Thank you for being here tonight.
So you would want I have x-rays and
or bring them with you for your appointment. You can send them ahead of time, and then they'll just be scanned in. We don't tend to usually look at things before the visit because it's, we don't treat the MRI, we treat you, so we want to see the MRI in context of your visit. So you can just sign a release of records to have it sent ahead of time, or you can pick it up and bring it with you. One thing to remember is that they technically have 30 days to send it, so people a lot of times will call the day before their appointment, and they are told like they'll send it right over. But yeah, they technically have 30 days to send it, so.
I have the orthopedic side.
Yep. I do send a release of records, and they send. I mean, we send people over there all the time. They're used to working with us, so. Yep. But yeah, anything you've had imaging-wise, bring that with would be great.
Question. I'm seeing
Yeah.
you tomorrow morning.
Yes. Hi.
Was I supposed to bring my papers in before?
Nope. Just bring them in tomorrow morning with like your new patient packet and all that. Just bring them with you tomorrow morning.
See
Yep.
you then.
Yeah. Sounds good.
Great.